Tacloban is in ruins, just decimated to the ground. It would almost be analogous to a giant bomb going off and just flattening the horizon. The place is just rubble.
Storm surge came through like a bulldozer that just erased almost everyone, and the surge significantly more fatal than the hurricane. So there were a lot of deaths, and buried under the rubble, a lot of injured who eventually expired because there was nowhere to get to them.
This country needs help, it needs foreign aid, and certainly we're here, a multicultural team, trying to deliver the best we can.
We've had the opportunity to go out to regions that have not actually seen any kind of medical response before, and so we knew we've made a difference.
The work we are doing, we're trying to make a difference in the people's life. We're setting up health clinics. Yesterday we have been to 2 camps, and today we are having another camp. So we're trying to respond to the people who are not been having any health care facility since the cyclone has occurred. There's no health care at all. So we are trying to go to areas, we're identifying the areas, trying to respond to them and give the basic health care whichever is possible to them.
Our primary objective is to come out to these surrounding areas that have had no medical care, to provide triage and treat the basic needs that we have the capabilities to treat, but also to identify those patients who are potentially sick or who are already sick and require emergent care.
Actually, this is a great opportunity that we are in the field, in the grounds, and the most important that makes me feeling good, that we are the first team who had the disaster area, and we are part of the whole organization working together to just build up the city.
And our fellowship, the objective is to train leaders in emergency medicine, to give them the tools to be able to enter into a devastated area and to help provide structure as well as medical relief to the people in need. This is what we do. This is the objective of our training. So just to be out here and to be able to put our training to use is just incredibly rewarding. And I thank Harvard as well as GR3 for giving us the ability to be able to deploy and to be able to make this difference.
The program has married the academics of disaster medicine with actual practice of it. So it's one thing to have been in a disaster and do the best that you could, whereas the program brings all the academics, the didactics of disaster response, and we get to actually apply it in a real life situation with other physicians who have experience in that process as well. So we get mentorship, we get training, and we get actual experience as well.
When I am here, I saw a lot of people and I can help them more and more as best as I can. And it reminds me what I want to do and what I want to be.
When we chose to become physicians, we didn't go into it for personal goals, or I think the main or central focus a lot of us had was to take care of patients. And this situation is the ultimate practice of medicine, when you give to those who are at their extreme vulnerable position in life. They have access to no one, and you can supply every bit of knowledge that you have when there aren't any other resources that you could necessarily rely on. So you're giving the best you can to people who need it the most. And so for me, that is fulfillment of my medical education as well as of my own humanity.